From our analysis, we found that almost 30% of the clinical trials which are currently ongoing for severe COVID-19 use mortality as either a primary endpoint or one of the composites of the endpoints. This was surprising to us given the fact that COVID-19 has such high mortality and we are testing drugs currently which do not test for mortality as one of the primary endpoints. My name is Akash Desai and I'm a graduating resident from the Department of Medicine at University of Connecticut and an incoming Hematology Oncology Fellow at Mayo Clinic. I'm here to discuss the clinical trial endpoints in severe COVID-19, an article which will be published in the upcoming issue of Mayo Clinic Proceedings. Our research analyzed Phase 3 clinical randomized controlled trials for severe COVID-19 utilizing the clinicaltrials.gov registry. We identified 19 studies which met our inclusion criteria. Of these 19 studies, we found that most commonly studied drugs were hydroxychloroquine and remdesivir as well as methylprednisolone. Of the 19 studies, we identified 12 different primary endpoints, of which the most common primary endpoints were time to clinical improvement, change in PaO2, also known as partial arterial oxygenation, divided by FiO2, which is the fractional inspired oxygen, as well as mortality being one of the primary endpoints. Our findings provide an assessment of the current clinical trial landscape among the clinical trials for severe COVID-19. Despite the limitations of our study, it does raise a concern that the use of surrogate measures as trial endpoints for drugs being studied with severe COVID-19 is a little concerning. The mortality rate of severe COVID-19 is as high as 30 to 35%, with an average time to death among patients admitted to the ICU being 3 to 4 days. Our study raises a concern that if we do not study mortality as a primary endpoint for the drug approvals in severe COVID-19, we might lose vital time as the pandemic might subside, and if we do not have well-designed randomized controlled trials which lead to drug approvals which actually do make a difference for the mortality, which is an outcome that patients care about. As the next steps in the research for COVID-19, we must prioritize drug discovery which makes a difference in mortality and use mortality reduction as a primary endpoint in order to ensure that we are not wasting valuable resources or not becoming complacent by approving or finding drugs which do not alter the mortality outcome in our patient. Thank you for listening. I hope you enjoy reading the article in the upcoming issue of Mayo Clinic Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.